We're so excited to hear that you've booked your surgery with us here at Watt Plastic Surgery.
We're going to go through a few important details as far as your specific surgery and things that you need to know ahead of time so that you're able to have the best recovery possible.
We've created detailed videos for each procedure. Now we're going to talk about a tummy tuck recovery. Oftentimes we combine tummy tucks with breast surgery, but it's important to note that these procedures have different restrictions and we want to make sure that you're taking care of your abdominoplasty appropriately.
When you go home after a tummy tuck, depending on your individual surgery, sometimes you'll have a binder on afterwards, sometimes you'll have a little compression board inside that binder. If we put it on, then we would like it on, and if we didn't, there's generally a reason. Sometimes too much compression can hurt the blood flow, a few different things. So if it's not on when you go home, don't worry. When you get home, you'll have instructions as far as exactly what you're supposed to do. Regardless, when you put that on, it's supposed to be on for some snug compression, not crazy. It shouldn't be cutting off blood supply to the skin or your head. You should have it on relatively snug. With tummy tucks, the same thing goes as far as showering. The day after surgery, we want you to shower. If you have your binder on, you take that off. Whatever gauze is over your big incision, you take that off. There's generally some tape that's like glued onto the incision. Obviously, don't take that off. That won't want to peel off. Over your belly button, there's usually a clear bandage with some gauze underneath it. You can leave that in place while you shower. For the most part, that will stay on until we see you at your follow-up. Soap and water over everything. Don't scrub it. Don't be overly aggressive, but make sure you're cleaning everything as best you can.
It's common to have bruising on the sides of the flanks if liposuction or extra skin excision was performed. This is very normal. It's also common to have quite a bit of swelling in the skin, making the skin look puffy. This will go down with time.
Depending on where the liposuction was done, you may have separate holes from your tummy tuck incision. If that's the case, those liposuction ports usually drain for a little bit into some gauze, usually for a day to 2 days, and then once that stops, they just close up on their own and they heal just fine like that. As far as the drains go, you may have 1 or 2 drains. Sometimes they're midline, sometimes they're a little bit off to the side. There's a separate drain video that is going to kind of walk you through how to take care of those, and as soon as we're able to, we'll get those out.
During a tummy tuck, we're pulling your excess skin downward and under tension. It's important to note that for the first 1 to 2 weeks, typically 2, you're going to be walking bent at the waist. Ensure that you're not pulling on the incision excessively, as this can cause healing issues or widening of your scar.
Also important when you're sleeping to make sure you're sleeping in that kind of bent position. So kind of in like a beach chair position where you're propped up behind, something under your knees to kind of take a little bit of that tension off as well, just to make sure that everything heals as best it can. So we've gone through all the things that you need to know for the specific surgery that you're having. Now, just a general list of things that you need to know, kind of regardless of what surgeries you're having or what surgeries you're thinking about having in the future.
Never use a heating pad after surgery. We do not want you applying any heat to the area.
That also goes for hair dryers and ice packs. Even though ice is not heat, it can still burn you and leave very not great looking scars.
No sexual activity for at least 4 weeks after any surgery.
No exercise. And I know exercise is, especially in South Tampa, everybody wants to do something. They want to exercise. They want to be out and about. You need to not. And exercise means no going for a walk, even around the block. No walking your dogs, regardless of how big or small they are. No weights on your lower body if you just had upper body surgery or vice versa. No yoga, Pilates, nothing. If it's something you have to think about whether or not we would say, yes, you can do it, you can't.
No swimming for at least 4 weeks after surgery and no baths. For optimal healing, it's important that you avoid smoking or vaping for at least 4 weeks after surgery. It's a really exciting time in the medical field with the age of GLP-1 medications. With that, we've got a couple restrictions and recommendations to ensure you have the best results possible with your surgery. With surgery, you're investing your time, money, and recovery to have an amazing result. But if you continue to lose weight after surgery, you may have excess skin that recurs that you'll want to remove. We want your results to last, so maintaining a stable weight within 10 to 15 pounds is crucial to ensure a lasting result.
If you're considering a tummy tuck or a breast reduction or breast lift, and you're considering losing more weight before you would want to have that surgery, you can have a consultation with one of the members of our team to talk about the GLP-1 medications and if those could possibly fit into your treatment process. The bottom line is just make sure that you you lose whatever weight you want to lose before you have those surgeries. Try to get within 10 or 15 pounds of that goal weight before you have surgery. The other important thing is all of those medications kind of affect your nutrition and how much you're able to eat, which then means how much protein you're getting. That directly affects your wound healing. So even if you stop those medications, you need to make sure that you eat an adequate amount of protein for your body weight to be able to make sure that you have enough nutrition, that you're able to heal the incisions, and that you don't have poor wound healing or other complications in the immediate post-op period.
No matter where your surgery is done, from head to toe, no tanning or sun after surgery for 4 weeks. After 4 weeks, if you are going to go in the sun, it's important to put SPF 50 or above on any incisions, even if they're below the bikini. The sun rays can go through clothing and still cause darkening of your scars. After surgery, we want to ensure that you have the quickest healing possible and make sure that there's no medication interactions. A lot of supplements can cause inadvertent bruising, bleeding, or interact with the medications we prescribed you. The only medications or supplements that you can take have been advised to you at your pre-op appointment. The only vitamins that we recommend or allow are a multivitamin for 4 weeks after surgery.
If you're having surgery, regardless of what surgery it is, you're going to have a coupon book that you go home with. One of the things in there that's important is discounted scar treatments. Those can be very important to make sure that you heal as best you can and that the scars look as good as they can. Your esthetician or nurse practitioner that you see will kind of know the best timing as far as when they want to start each one of those individual things.
Common treatments our estheticians provide for scar care are microneedling, laser therapy, and also pharmaceutical grade medical skincare to help for the best scars possible.